to a 25-week delivery. As you see, our transporter is set to 37. It's currently 37.9, so it's warming up. We're going to OR2, where the temperature should be set at 75 and is 77. And as you can see, it's currently at 75, so it is warming up.
So for a 25-weeker, when you set up and go to the delivery, you're going to want your warmer to be prepared. So you set the temperature all the way as high as it can go on manual mode. You have your temperature probe ready to go to hook onto the baby once born. You have your hat all ready to go. Important to remember as well is your chemical mattress needs to be activated and ready to go. Your neo wrap, and you want to make sure that your oxygen is set at the correct limit. You start at 40% FiO2. You have your pulse oximeter, your neo puff, and we are ready to go.
It's important to have the OB doctor put your 25-weeker into a warmed environment. So we're going to lay pre-warmed blankets down first. Then we'll apply our sterile drape over that so he can lay the baby in sterilely. From that point, we will grab the baby and put him on the preheated warmer.
Remember to ask the obstetrician to milk the cord prior to handing off the baby. Okay, we have a baby.
As you can see, a very important point is to make sure that the baby is warm. We are applying the pulse ox, a hat, and a temperature probe. And it is very important to wrap one layer over the other with the neo wrap. And we are setting this warmer to servo mode.
That's it. So
It is important for someone to be monitoring the temperature so that way it is around 37 degrees Celsius. Important to keep the transporter isolette doors closed to make sure that there is no heat escaping prior to placing the baby in the transporter to then go to the NICU. And prior to this, you want to make sure that your oxygen tanks have been checked by respiratory therapist.
We're going to get ready to prepare to put the baby into our transport isolette. So we're going to take the temperature probe off of the baby and swaddle him in our blankets to help keep him nice and warm with the chemical mattress and the neo wrap on still.
get our pulse ox on.
Yes. Alright, so I think we're all ready to go here. And as mentioned, we're not going to open the warmer or the transport doors until ready to be put in. Let's see if we do this. Okay.
All right, we're done.